All right, let's jump right into this. Welcome to our explainer on veterinary cardiovascular pharmacology. Today, we're going to be looking at the mammalian cardiovascular system, but I want you to picture it like a high-performance engine. Think about it. You've got a pump, a massive network of pipes, and the vital fluid running through the whole thing. And just like a master mechanic, veterinarians use incredibly specific pharmacological tools to tune this engine up the second it starts to misfire. When we think about a peacefully sleeping veterinary patient recovering from a major cardiac event, it really grounds our whole scientific journey in reality. It's a great reminder that our ultimate goal here isn't just to memorize a bunch of cellular receptors or chemical pathways. We're applying this knowledge to keep the biological engines of these animals running smoothly so they can actually live healthy, comfortable lives. So, here's our roadmap for the explainer. We'll start by checking the heart's electrical wiring. Then we'll look at pumping things up with myocardial stimulants, fixing the rhythm with antiarrhythmics, easing the pressure using vasodilators, controlling clots with blood modulators, and finally, building blood with hematopoietics. Let's get to work.
Section 1. The heart's electrical wiring, understanding the action potential.
Okay, before we introduce any of our mechanics tools, we have to understand the baseline. To fix a heart, you've got to know how it beats at a microscopic level. It's all about this chronological movement of ions that creates a heartbeat, the action potential. In phase 0, bam, sudden opening of large sodium channels. Sodium just rushes in, causing rapid depolarization. Then in phase 1, those channels close up and potassium starts leaking out. But phase 2 is where the magic really happens. Slow calcium channels open, and that gives us a prolonged plateau. Finally, phase 3 kicks in. Calcium closes, potassium pumps out to reset the cell, which drops us right into phase 4, a stable, negative resting membrane potential. It is literally a perfectly choreographed microscopic dance.
Section 2. Pumping up. Myocardial stimulants to boost a failing heart.
So, what happens when that natural electrical dance just isn't enough to generate a strong physical squeeze? When a heart is failing to pump enough blood, like in congestive heart failure, we reach for positive inotropic drugs. Take a drug like Digitalis. The way it works is by setting off this incredible microscopic domino effect. Step 1, it blocks a really simple cellular doorway called the sodium-potassium ATPase pump. Because that's blocked, intracellular sodium builds up. That excess sodium actually slows down the sodium-calcium exchanger, effectively trapping calcium inside the cell, which then heavily loads into the sarcoplasmic reticulum. So, when that next action potential arrives, it triggers a massive release of all that stored calcium. It binds to troponin, the muscle fibers slide together, and suddenly you get a significantly more powerful heartbeat. You know what's wild, though? These incredibly potent heart stimulants are actually derived from nature. The cardiac glycosides we just mentioned come straight from botanical sources. You've got the purple foxglove giving us digitoxin, the white foxglove providing digitoxin, and the seeds of the strophanthus plant giving us uwaban. It's pretty amazing going right from a garden plant to a life-saving veterinary intervention.
Section 3. Fixing rhythm, antiarrhythmic drugs, and restoring the beat. Now that we've got the pumping strength sorted, what happens when the engine's rhythm goes entirely chaotic? That's when we pull out the antiarrhythmics. Our tools here are broken down into 4 distinct classes, all based on exactly which ion channel they're blocking. Class 1 targets sodium, using drugs like quinidine or lidocaine to slightly slow that phase 0 depolarization we talked about. Class 2 relies on beta blockers, like propranolol or esmolol, to inhibit sympathetic activity. Class 3 blocks potassium, widening the action potential duration with agents like amiodarone. And finally, Class 4 brings in calcium blockers, like verapamil or diltiazem, to flatten out that plateau and slow conduction in the AV node.
Why do we even need 4 different classes? Well, cardiac arrhythmias disrupt the normal function of the heart, leading to a potentially deadly loss of atrioventricular synchrony. Whether we're dealing with a tachyarrhythmia, like atrial fibrillation where the rate is way too high, or a bradyarrhythmia, like a sinus arrest where it's dangerously low, we need these specific, targeted drugs to suppress the abnormal rhythm. We have to restore that synchronized beat if the animal is going to survive.
Section 4. Easing pressure with vasodilators, expanding the pipes.
Okay, the pump's strength and rhythm are corrected. Let's shift our focus to the pipes, the blood vessels. If those vessels are too tight, the pump has to work much harder. To fix this, veterinarians basically act as plumbers, bringing in vasodilators that serve as pressure release valves to relax the vascular smooth muscle. We have a really robust toolkit here. We use direct-acting agents like hydrazine. We use calcium channel blockers and potassium channel openers like pinacetyl, which hyperpolarize the muscle. We also rely heavily on ACE inhibitors acting on the renin-angiotensin system and unique inodilators like pimobidan that manage to simultaneously sensitize the heart to calcium while dilating the periphery.
Let's look a little closer at a direct-acting mixed vasodilator, nitroprusside. This mechanism is so cool. The drug is actually metabolized by endothelial cells and transforms into a simple active gas, nitric oxide. This gas signals the production of cGMP, which basically acts like a sponge, soaking up calcium and moving it away into the endoplasmic reticulum. Without that calcium around to bind with calmodulin, the actin and myosin in the vascular muscle literally can't interact, so the entire vessel just beautifully expands.
Section 5. Controlling clots and bleeding. Managing the fluid itself.
We fixed the pipes, so now we transition to the fluid running through them. Look at the sheer contrast in the drugs we use to manage this. On one hand, for a hemorrhaging patient, we're using systemic coagulants like vitamin K. These are absolute lifesavers because the liver absolutely requires vitamin K to synthesize clotting factors 2, 7, 9, and 10. But on the exact opposite end of the spectrum, we have anticoagulants used to dissolve or prevent deadly thrombi. We use heparin in vivo to facilitate antithrombin 3, or we prescribe warfarin, an oral anticoagulant that blocks the vitamin K epoxide reduction enzyme. It's competitively antagonizing the very process that forms clots.
But what about immediate localized bleeding? If you're dealing with a surface wound, you don't always want to rely on systemic drugs that affect the entire body. Veterinarians have a whole separate toolkit of local and topical agents designed to halt bleeding right at the source. They can apply concentrated clotting factors like thrombin directly to the wound. They can use physical occlusives like a gelatin sponge to just physically stop the oozing. They can even use a catecholamine like epinephrine as a localized vasoconstrictor, or non-pharmacological styptics like silver nitrate to literally seal off the vessel.
And, sometimes it's not enough to just form a clot. You actually have to protect it. The body naturally tries to break clots down over time through a process called fibrinolysis. But in severe, life-threatening cases, we've got to use fibrinolytic inhibitors, like aminocaproic acid, to urgently halt that breakdown process. It effectively shields the clot, maintaining that vital seal until the patient can finally stabilize.
Section 6. Building blood. Hemopoietic drugs. Enriching the oil.
All right, we fixed the pump, relaxed the pipes, and patched all the leaks. Now we have to enrich the oil of our engine. When a patient is suffering from anemia, a serious deficiency of red blood cells, we use hematopoietic drugs to jumpstart production in the bone marrow. But to cure these conditions, we have to provide the specific raw materials. Iron is absolutely crucial for hemoglobin synthesis. Without it, you're looking at microcytic hypochromic anemia. In ruminants, we use cobalt because it enhances vitamin B12 synthesis by their unique rumen microflora. We use copper for essential enzymes, various B vitamins, and even powerful growth factors like erythropoietin to directly command the marrow to build fresh, oxygen-carrying red blood cells.
When you really step back and look at the big picture, isn't it just incredible? Mastering the microscopic dance of sodium, calcium, and potassium, or knowing exactly how to manipulate the synthesis of a clotting factor in the liver can so profoundly restore an animal's health. We've essentially taken a failing biological engine and, using highly precise molecular tools, tuned it right back to perfection. So the next time you're holding a simple, everyday pill bottle, I want you to ask yourself, what incredible, microscopic domino effect is waiting inside to save a life?